this presentation it will be done by me and by my colleague Jean-Marie Mitzella from the Information and Technology Department of DG Sante. And it's a little bit like a zoom out from the Vascairn ERN and more into the context of the European Reference Network project. So we already went through all these pushes that make us, the member states and the scientific community and the patients organization start working on this project, setting up, organizing it, and ask for organize a legal basis, so a directive and other pieces of legislation that upon which we are building this, all this infrastructure. So the basic idea, it's really simple. It's about equity and quality of care across Europe. It's about pulling together knowledge and trying to enhance the care for all European patients suffering from rare diseases. I will jump from early 2005-ish to 2016, so the end of the first call for European reference networks, and those are the numbers. You already familiar with the idea that 24 European reference networks have been approved and are currently a reality in Europe. 26 countries in Europe are involved in this project, 25 European member states, and Norway. In total, we are almost 350 hospitals that are part of the different ERN, and more than 900 healthcare units, which means that there are big hospitals in Europe that have members in different ERN. You see again, this is the picture of the 24 European reference network coordinators in Vilnius this year, where they've been officially appointed and recognized as leader of these networks. And well, here you see them in a picture together with our commissioner and the Lithuanian and Maltese ministries of health. This picture, the list of the 24 ERNs, you already seen it before. But here I put it just to spur our thoughts on the idea that you will mainly work within your ERN, so Vascairn, but Professor Jondot, together with the other ERN coordinators, are really thinking also on working cross ERN. So one patient that will be treated within your ERN maybe also benefit from the consultation of other healthcare professional in other ERN, and then of course this is part of the project. So we are not creating new boundaries like it was feared before, but we are really trying to create something that is also cross-cutting. This is a picture that gives you a graphic idea of how an ERN will work, more or less. It's really, a broad idea. It's just that you see that between the patient and the ERN, there are always or almost always be local healthcare providers. This follows the idea that is knowledge that travels rather than patients, the idea that patients are better care and cure in local settings, and there are healthcare providers that when they think it's needed, they're gonna virtually consult other colleagues across Europe, and then they will try to achieve a better diagnosis or a more effective treating locally. Patient will be moved only when it will be deemed necessary by the healthcare professionals. But again, ERN are not only about virtual care, they are also about knowledge sharing and research. So the same will apply for these other fields. It will be always the ERN that will collect and then pull together the knowledge and create, we say guideline, we say the recommendation, expert opinion, and so on. So this is give you an idea of where are we now. So as I said, the legal date where we started the project, this was 2011. Now, 6 years afterwards, we are in the deployment phase, so the 24 ERNs are a reality. They are not yet working full speed ahead, but as we'll listen a couple of minutes ago, you already consulted within the ERN for more than 26 patients. So this is really, you already start working. We expect to have a consolidated, a more consolidated phase in a couple of years' time. We are developing a monitoring and a continuous assessment system together with member states, with the ERN coordinators, to ensure that the quality and the standards of this project remains high. We will, in 5 years' time, there will be the reassessment of the ERN that are there already. And then the project cycle may start again. This doesn't mean that we will wait until 2021 to have new calls. And I will, the French representative of the board, we will tell you more about this later. I just want to spend a couple of words on the importance of member states, because you know how much you are important, you know how much, well, patient association and patients are important. We are the secretariat running this project. But this project has been possible because member states realized how it was important to pull together resources across Europe. They voted, they passed law for us, and they individually they approve each and every application that you had to submit, and then all together they sit in the board of member states. It's a board that help us defining the strategies for these projects, give you guideline on some a couple of well, more than a couple of issues, and then have approved the 24 ERN. They've approved your membership. They also have the power to withdraw membership, and they will approve the newcomers. Together with member states, there are many other players that are really important, have been fundamental for this project to run. We have established officially the group of the ERN coordinators. They are now an official group of the European Commission, and together with them we are working on the board. And the board and coordinator start working together to improve and to keep this project running. We have a number of stakeholders that have really been, they played really a great role, a fundamental role for this project. With patient association, we really work a lot with the RORDIs here. And then, I mean, the Joint Action on Rare Disease has been extremely supportive to us, the Joint Action on Rare Cancers, and professional scientific association across Europe. And then you see in the bottom, the European Commission, of course. But we listed all the actors also within the European Commission, because this is a project that goes beyond only healthcare, but it's in interest of many departments of the Commission. So we are also working across different DGs on this. A couple of words on what's on the discussion table right now. So you can see the different working groups of the board of member states and of the coordinators. You see that the same topics is listed in the two columns. This doesn't mean we are duplicating effort. This means that we are creating synergies between the member states, so the government, healthcare systems, and the coordinators, so the scientific part, to create, to work on different topics. So we already said to work on a monitoring system, to help the Commission also create the digital infrastructure necessary to run this project, on new form of membership, on affiliated partners, on a new call, on their relations with industries. It has been said before that the working group is working on a code of conduct. He also working with the member states to approve and design and define this relationship. And then there are other topics like research and knowledge generation that are mostly dealt within the ERN's coordinators group, while the integration with the national healthcare system is mostly dealt at the board of member state level. This is a particularly important topic that again will be dealt later. It's really important for us because we really believe that ERN should be integrated in each national healthcare system and not just be a sovereign structure of European one that floated around Europe but is not connected with the member states. new players that are entering in the game. I mean, they'll always be there, but now they are more active. Are the hospital managers. So here, just spare a couple of words to invite those of you that think that their hospital manager would be interested in participating in a discussion on how ERN members should receive support by the hospital manager, but also how hospitals will benefit from having an ERN in their own setting. So there will be a workshop we're organizing in Rotterdam in a month's time, and there are still spaces available. So you feel free to send us an email or tell your hospital manager to do so, and we will come back to you. Last slide on the expected impact of this project. There will be positive impact, hopefully, for patients, for professionals, for healthcare society, for a healthcare system, and for society. So for sure, we already succeeded in raising awareness on the world of rare, complex, and low prevalence diseases. We surely aim to increase the likelihood of early and accurate diagnosis and effective treatment where possible for patients suffering from rare diseases. You are developing guidelines, you are creating new knowledge, you will also work on, you were speaking about this a couple of minutes ago, on clinical trials, just trials, in a broader scale, so that, of course, they will be much more effective than it locally. And the healthcare system will, ERN will help innovation and digital services entering and be adopted by the different national healthcare systems. This is also an impact that we have listed. And then, of course, the development of new care models and innovative medical solutions that can challenge, change, and make more effective the way you treated the patients. And then an eye on the society and on the economies of scale that are also important because this project should have impact also on the effectiveness of a healthcare system and the way the budget is spent. This is my last slide before leaving the floor to Jean-Marie, is a point of information, just to let you know that the draft work program 2018 and 2020 of Horizon 2020 has been published at the beginning of this week. You will find calls for the rare disease community, so you may be interested to go to this link and read the program. We just listed a couple of calls we are expecting. The one on the rare disease European joint program will be discussed later, and then the others.